my name is Teresa. I have my daughter Lydia with me. I give consent for Lydia to be in this video for the purpose of this course. Lydia, do you give consent?
Yes.
Yes. So I would walk in, wash my hands, I'd introduce myself to Lydia and say, hi Lydia, my name is Teresa. I'm a nurse practitioner and we'll be doing your assessment today. I would then look at Lydia and have her sit on the exam table after questioning her. And so then I would start by looking at her demeanor. Is she happy? Kind of her body language. And then I would start the assessment. So I would look at her scalp. I would look at her skin and feel for any bumps, lumps, or any abnormalities in her head, her skull, or anything. And then I would look at her face and ask her to move her eyebrows up and down and smile and see and watch her facial movements. And again, looking at her skin, noting any freckles or any discolorations or dryness. Then I would look at the exterior of her eye and look and see if there's any discolorations or anything abnormal about her exterior of her eye. And then we would start. So let me know when you can see my hand. Okay. Good. Good. And then I would ask her to follow my finger. And again, I'd be looking at her eyes, looking for any strabismus, any nystagmus, any lid leg, or anything else. And then I'm going to have you cover your eye. Yep, that's fine. And your right eye, go ahead and just read this line, the 20/20 line. So this line.
D-E-F-P-O-T-E-C.
Great. Now cover your other eye. Yep, and read that line again.
The one below.
No, this same one.
D-E-F-P-O-T-E-C.
Very good. Yep. All right. And then we would take the otoscope and put it together. Make sure. Okay. Sit up, honey. And then I would have her look over my shoulder, and all I'm looking for is the red reflex. Oh my gosh, can you look over my shoulder? Yep. And then I would examine her other eye. Yep. Good. My poor light's going. And then, given it's so bright, it'll be a little bit hard to see, but I would probably have a light pen, since that would be better. And Lydia, look at me. And I would look for the reflex of her eye. And as it would get smaller with the light. Good. All right. And then I would look at her ear, and I again would look at the outside of her ear, look at the skin, look at all of that, and make sure everything looks nice. And then I would go ahead and look in her ear. Actually, should we do the hearing first? I'll look in the ear first, don't let me forget. And then we'll pull back on her ear, look in
It's
her.
gonna take off.
Okay, I'll try not to go. It's okay. You okay?
Mm-hmm.
And I look at the tympanic membrane, make sure everything is okay. And then I'd go to this side, and again, look in her ear, pull on her ear a little bit, and straighten out the ear canal, and look and make sure that the tympanic membrane looks okay, and everything else. And then I would cover one part of her ear and say a 2-syllable, okay? A 2-syllable word like hot dog.
Hot dog.
And then I do the other side. Hot dog.
Hot dog.
And that's how we would make sure that your hearing is better.
Or when you're not deaf.
And and then we would, again, feel her sinuses, feel for any tenderness or any tenderness in the sinus area, and we might as well do your jaw. Can you, open, clench down? Yeah, good. Any pain or anything with that? And then can you open your mouth, move your jaw side to side, front and back? Yep, good. All right, so then I would take this and you could do a smell test with her, and she could plug her nose, one side of her nose, and see if she can smell this. What does it smell like? Good. Yep, good. Yep, and I would make sure that she could breathe out of both of her noses. Then I'd go ahead and look, and now this might tickle your nose just a little bit, okay? So then I would look up her nose, look at the turbinates, make sure everything looks good and there's no polyps or obstructions or any of that. And then I would look at the other side. You okay? A little bit long. Okay. Yeah, sorry. Okay. So then we would do that. And then we would, you okay? Sorry. And then I would look at her lips, look for any cracks or anything. Again, constantly looking at her skin and any abnormalities. And then I would have her open her mouth up and tell her to say ah. And I would look at her soft palate, look at her tonsils, her uvula. I would look at her, I would look at her dentation. I would look at, can you lift your tongue up? Yep. Can you move it to side? Yep. And stick it out. Yep. Good. And I'd be looking at the mucosa and everything else in her mouth, looking for any lesions or anything. Can you smile? Can you puff your cheeks? Good. Okay. And then we would move further down her neck. So we would feel for her trachea. We would feel for her, can you swallow? Yep, her thyroid gland, and making sure and everything's going up and down and everything's moving properly. And then we're gonna go ahead and feel for, why don't we do sensation now too? We'll go ahead and have you close your eyes and you tell me, well actually open your eyes for a second, and this is sharp or whatever, and this is more soft. Go ahead and close your eyes and tell me if you can feel that. Where am I touching you? Where am I touching you, honey?
On the cheek.
Yeah.
Forehead. Arm.
Mm-hmm.
Arm.
Mm-hmm. Sharp or soft?
Sharp.
On leg. Mm-hmm.
Or
Okay, tell me.
shins.
Hmm.
Wait, so the shin is inside.
No, this is a thigh. Thigh. Shin.
Like a chicken thigh.
Yeah. Kind of like a chicken thigh. Okay, great. All right, so you have sensation, it's intact. Okay, let's feel for your lymph nodes. So we're gonna feel her lymph nodes. Preauricle, postauricle, submandibular, and all both joints, and submandibular. Yep. Dental, your thyroid, all the way down, anterior cervical, sternal clavicular area, all the way in the back, posterior cervical. Good. Yep. That feel good? And again, I'd be looking at her skin and making sure everything is okay. So then I would continue down, again, looking at her shoulder, looking at her arm, making sure everything, I don't see any lesions, bumps, feel her joints, make sure that that's all okay and everything else. And then I would have her push up. Mm-hmm. And then ear to ear. Yep. Push against me. Yep. And push against your neck though, honey. Yep. Now move your neck. Yep. Perfect. All right. So then we would go ahead and have you put your arms out. No, not yet. Out. Up. And then, yep. Yep. Back. Bend it like this. Yep. Bend it like that. Yep. We'll test your strength. Like this. Push out. Yep.
Like pull in.
Yep, exactly. Now go like this. In and out.
No.
Yep. Good. Make a fist. Don't let me move it down. Yep. Oh, yeah. Good. Good. All right. Anything else from that standpoint? Okay. Yep. No, grass. Squeeze, 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 squeeze as hard as you can. Good. Yep. Good. Yeah, you cracked my fingers. Good job. All right. And then I would look at her knees and everything. Push up. Push down. Out. In. Yep. And then I'd go down here. Kick out. No, kick out. Yep. Kick back. Yep. Good. Push down. Push up. And then go. Yep, exactly. So, go like this. Point. Yep. In. Center. And out. Yep. And the same thing with the other side. Yep, and we did this. Yep. Okay. So again, when I'm looking at her legs and doing those things, I'm looking at her skin and making sure I don't see any lesions. I'm looking at her muscles, making sure that they're not atrophied or any deformities in her knees. I'm looking at her knees, feeling her joints, making sure that there's nothing wrong with her joints, no inflammation or feeling or edema or anything. Same thing with her legs. All right, and then now I'm going to do her chest area and her respiratory and cardiac status. So I'm going to go ahead, look at her chest. I'm going to evaluate the way she's breathing, making sure she's comfortable, not gasping for air or leaning over. I'm going to look at her AP diameter, make sure, you sit up, honey. Make sure she doesn't have a bellowed chest or pigeon chest or any of those sorts of things. And then I'm going to go ahead and just feel. I'm going to feel for a couple of things while I'm doing this. So I'm going to feel for any lung abnormalities, any fremitus, any, what's the other one? Crepitus or any of those sorts of things. And while I'm doing that, I'm also going to feel for any thrills or anything from the cardiac or from the heart feeling. So I'm going to go ahead and feel some of that, noting both front and back as she takes nice big deep breaths in and out and yawns and everything else. And then I am going to, I could listen to you if I want to, I suppose. So I'll do her lungs first and then I'll do her cardiac. So big deep breath in and out. In and out. Good. And then just move your hair lid. And again, I would do this under her clothes, not over the top of her clothes, so that I don't get any interruption. You gotta sit up straight, honey. Big deep breath in and out, in and out, in. And then I would percuss And I would find the diaphragmatic excursion too. And make sure everything sounds good. Then I would go ahead and listen to her cardiac. So, just look at her here. So, aortic, pulmonic, herbs or tricuspid, and the apex. Sorry, does that feel weird?
Feels like a bruise.
What did you say?
Feels like a bruise.
Oh, it feels like
Press down right there.
Oh, okay. So then I'm gonna have her lay down and we'll do the abdominal assessment. And we'll cover you up and just leave you, okay? We provide these cozy blankets for you. So again, we would look, okay, that's fine. Yeah. I go ahead and I inspect and look and make sure, looking for, put your hands on your side, any bulging, any abnormalities, any contours. I also can see if I can see the aorta pounding away in there. Yep. And freckles, any skin. Yep. Because you wear bikinis. Okay, great. All right. And then I'm going to auscultate her vowel sounds. So we'll go in all quadrants, listening for the peristalsis. Good. And then I suppose I could listen for, while you're laying down here while I'm thinking of it, you can do carotid bruit and aortic bruit and feel the pulses while I'm doing this. And radial and brachial. Yep. And then I would palpitate. That might be a little bit out of order. I would listen. I palpitate. And then I would deeper palpitate. And then I would try and find the liver's edge, mid-clavicular, and hear a dull. Take a deep breath in and out. And then I feel your liver's edge. Try and feel your kidney. And I also, that's one way I can see if there's any costal tenderness. And again, your other kidney. Costal tenderness. And then I would try and find her aorta with, it's actually a little bit harder to feel your aorta. All right. So, I was going to do that too. So then I'm going to listen to her. Aortic. Listening for bruits, like I said already. Iliac. Femoral. Again, feeling any bruits. See if I can feel your femoral. No. Oh yeah. Oh, good. You got a good femoral pulse. Popliteal.
So like right here.
Yeah, you want to feel it?
Oh, I kind of can feel it.
No, just hold it. Use these two fingers. It's right there. You don't have to press super hard.
Oh, I feel it.
So I did popliteal. Pedal. Anterior tube. Good. Actually, I probably could cover you up. Sorry. we are gonna do, okay, I'll do femoral again. Yeah, really good. Behind the knee, top of the foot, posterior tib. Good. So I'm gonna have you bend your knees, bring it to your chest. Yeah. Oh, I forgot to do that with your neck. Out. Yeah. So bend your knee, bring it towards your middle line. Yep. This way, towards your middle. And out. Yeah. And straighten it. And do the other side. Yep. Out and in. Straight in. Yep. Lift it up. And come that up. Good. And that up. All right. Okay, you can sit up. Will you sit up? I should say. And then, I forgot, we can do your reflexes. Actually, yeah, we'll do your reflexes. So this would be your bicep, tricep, I get it? No, I can't do it there with your watch. Brachioradialis. Bicep, tricep, patellar, either one, and your ankle. Back of my ankle, yeah. All right. Have you stand up, honey. And then you could do heel to toe.
Oh.
You know, like this. Yep. Very good. And then I'll have you stand with your feet together. And will you bend over? Touch your toes. No, not that one yet.
I don't know.
And looking for her back, looking for any deformities. Again, looking at her skin and her ability. Roll up, honey. Okay, look up. Put your head up, look up. Look down. And side. No. No, do your head side to side. Over your shoulder. Over your other shoulder. Good. Now bend side to side. Yep. And bend back. And you bend forward. Yep. Good. All right. So then feet together. And close your eyes. So feet together. Close your eyes. And then I'd be looking for balance. All right. And open your eyes. I don't know if I said to your chin. Yeah. Okay. We might have forgotten that. I can't remember if we did it or not. And then we'll have your hands out in front of you. Go like that. And it's a pronator drift. And yep, close your eyes. And for 30 seconds, we will see if you drift with your arms.
Like this?
Yeah, like that. No, like this.
What happens if I did?
And then you have something else going on. All right.